To collect diagnostic samples from the external bird, you will need the following supplies: sterile Dacron-tipped culture swabs mounted on a plastic shaft, a variety of transport tubes containing media suitable for aerobic and anaerobic bacterial isolation, mycoplasma isolation, and viral isolation. You will also need disposable Q-tips, cotton swabs or gauze, 70% alcohol, several sets of sterilized scissors and thumb forceps, a disinfected knife or sterile scalpels, several jars with screw-top lids, 10% neutral buffered formalin, sealable plastic bags, a magnifying lens, a pen or waterproof marker, and diagnostic lab sample submission forms. Swab samples can be collected from the mucosal surfaces of the oropharynx, sinuses, and cloaca. These swabs often provide a good source of virus, bacteria, and mycoplasma for laboratory testing. There are a variety of different types of culture swabs available commercially. In general, you should avoid calcium alginate swabs, cotton-tip swabs, and any swab mounted on a wooden shaft. Chemicals in these products can interfere with some tests. In most circumstances, pre-packaged culture swabs and transport tubes are a suitable and convenient option. Some varieties of culture swabs contain transport media. Transport media is high in protein and provides a moist environment, helping to keep microbial agents viable. If your samples will be shipped to a laboratory, it's a good idea to use tubes that contain transport media rather than submitting a dry swab in a transport tube. Be certain to select the appropriate transport media for the different tests you are requesting. Samples destined for virus isolation should be placed in Amy's transport media. Amy's transport media is also recommended for mycoplasma isolation. Sometimes antibiotic additives are used to ship viral samples to prevent bacterial overgrowth. However, antibiotics should not be used in samples destined for bacteriology. Amy's transport media with charcoal is a good all-purpose media for aerobic bacterial isolation. For anaerobic bacterial isolation, Carey Blair transport media is recommended. Before beginning sample collection, it's a good idea to pre-label the tubes with the farm name, flock number, date, and the body region from which the samples will be taken. Begin by opening the packaging, being careful not to contaminate the swab. Turn the chicken on its side with the legs facing you. Grasp the feet in your opposite hand and hold the wings against the feet. Grasping the body, tuck the chicken under your arm with the ventral side facing up. Open the beak by pulling the comb and wattles. Insert a finger into the oral cavity to hold the beak open. Remove the sterile swab from the packaging. Insert the swab into the back of the oral pharyngeal cavity. Rotate the swab around the tracheal opening while vigorously scraping it across the mucosa. Don't induce mucosal bleeding, however, as this may interfere with testing. Next, insert the swab into the choanal cleft several times, moving the tip around in different directions. The goal in swabbing is to retrieve as much mucus as possible. Once you've collected the sample, place it directly into the transport tube. Swirl the shaft between your fingers several times and make certain the end is securely sealed. For viral surveillance, you can pool up to 5 swabs taken from different birds into one transport tube. Swirl the swabs in the transport media and remove them, expressing the contents into the transport tube. When using this method, never mix samples from more than one body region, like the cloaca and the oropharynx, as this may interfere with testing. Swab samples can also be collected from inside the infraorbital sinuses. This is an effective way to detect bacterial infections involving the sinuses, such as infectious coryza, mycoplasmosis, and foul cholera. Begin by cleaning the skin over the sinus to reduce bacterial contamination. Use a disinfectant, like alcohol, that will evaporate quickly. Using sterile scissors, expose the sinus cavity. If there is mucus in the sinus that is not clear in color, secondary bacteria are likely present. Swab the sinus about 5 times with disposable Q-tips to reduce the level of contaminating bacteria. This technique is particularly important for diagnosing diseases such as infectious coryza, where contaminant overgrowth will interfere with the true causative agent. Discard the used Q-tips and collect a swab sample for laboratory submission. Remove the swab and place it immediately into the transport tube. Swab samples for virus detection can be collected from inside the cloaca. To collect a cloacal swab, move aside the ventral tail feathers to expose the vent. Insert the tip of the swab through the vent into the cloaca. Rotate the swab against the mucosa 2 or 3 times. Remove the swab and shake off any excess fecal material to reduce bacterial contamination. Place the swab directly into the transport tube. Swab samples can also be collected from the joints for viral isolation and bacterial and mycoplasma culture. This procedure is recommended in cases where joint swelling is observed. To begin, swab the outer surface of the skin with alcohol. Using a disinfected knife or sterile blade, open the joint. Insert the swab and rotate it around the joint, collecting any exudate that may be present. Remove the swab and place it immediately into the transport tube. Remember, samples destined for viral, bacterial, and mycoplasma testing should ideally be submitted in separate transport tubes. Bacterial isolation can also be obtained from bone marrow swabs. This may be a good option if you are trying to make a diagnosis from partially decomposed birds, as the bone marrow is not readily invaded by contaminants. Break a leg bone in half to expose the bone marrow. Insert a swab into the marrow cavity and collect a sample. Remove the swab and place it immediately into the transport tube. In the next stage of sample collection, evaluate the chicken for ectoparasites. You may find it useful to use magnification to examine the skin and feathers. Look for evidence of lice moving around the body feathers and for their eggs, called nits, deposited on the base of the feathers. Individual lice and feathers containing nits can be collected, placed in a sealed container, and submitted for identification. Fleas are typically found on the surface of the skin and can also be collected. Examine the area surrounding the vent for mites. These slow-moving parasites can be collected by plucking feathers and submitting them to the laboratory for identification. In the last stage of the external sample collection, you can collect sections of the comb and skin. Using scissors, remove the comb and divide it into 2 pieces. Place one piece in a sterile container, such as a jar. Place the second piece in a formalin-filled container for fixation. If skin lesions are observed, you can also remove a section of skin for virus isolation at this time.